There simply is nothing more important for New York than a healthy population. So we're committed to that, and the people we're honoring tonight are committed to that.
I think of myself as the city's doctor. My job is to protect and promote the health of all New Yorkers, every single one of us.
I'm Chef David Bouley from Bouley Restaurant here in Tribeca, where I've been now for 29 years.
I am Director of Peritoneal Dialysis at the Woodside Rogosin Dialysis Unit.
And I'm the Medical Director here at the Auburndale Dialysis Center and at the Queens Dialysis Center.
But one of the things that I really admire about Rogosin is it's stated an emphatic commitment to community involvement and to grounding yourselves in communities that have an excess disease burden. And that's something that I've really tried to reinvigorate at the health department since I've been health commissioner, because that kind of unity between governments and the people is what really gets things done. And having nonprofit organizations part of this really adds something that I don't think that governments or residents will ever have on their own. So these are very important coalitions.
So the Rogosin Institute for me is a center of vast knowledge that a professional chef like me could learn from, who is trying to cook as healthy as I possibly can.
New York City should be an example for other large cities, not only in the United States, but across the world. That idea of service and service with excellence to create better lives and quality of life for people is what Gail and Dalia are all about.
The comprehensive model for treating kidney disease is really going to be involving the entire community. More education for our patients, education for the community, having them involved as partners in their own care.
It's a pleasure actually to have partners to do this kind of work, because otherwise helping people get healthier in New York would not be possible. Chef Bouley, he opens up his kitchen to teach people how to eat properly, eat healthy, eat lighter, and all of these different kinds of things together can really make a difference in a community.
To refocus and revitalize our efforts at that level, I set up the Center for Health Equity, because it's not enough to say that we all have to, on average, see our health improve. We want to see disease rates go down, but we also want to see the gap between neighborhoods narrow, not widen. And in order to do that, we have to focus on the gap.
Partnering with nutrition providers in our community at large, with restaurants and chefs, to raise awareness about how important nutrition is to health all the way around, particularly in terms of high blood pressure, diabetes, and kidney disease, where nutrition plays such a large role.
So food is the conduit. The Doctor and Chef series is very simple. A doctor and I meet, we discuss what foods have functioned in his practice with success and results. I learn from him, I create a meal.
Medicine, in the best sense of the word, has to be out where people live, work, and play, because that's where we're going to make the difference. That's the spirit of medicine. That's what Rogosin is all about. That's why we need to work with Dr. Bassett and with Chef Bouley and with the people in the community, because it's that leadership that's across the board that's really going to make the difference.
We would like to be certified by Rogosin to contribute to kidney health through the vast amount of recipes and foods that we have.
People confront all sorts of issues that may make it hard for them to follow medical advice, but that we also have an added commitment that we must pursue. I'm actually calling on doctors to think about their whole patient and advocate for their whole patient.
We need to mobilize the people of New York in all their wonderful diversity to work together to change the patterns of the way we live, because that's the way we're going to create better health.